Hi, I'm Dr. Michael Murray. I want to tell you about a special clinically proven form of silicon known as BioSil. BioSil is a highly absorptive form of silicon where the silicon or orthosilicic acid is bound to choline. The choline acts as a stabilizer and a transporter of the silicon into the cells. Once into the cells, BioSil has a phenomenal ability to stimulate the manufacture of collagen. Collagen is the most abundant protein in our body. The word collagen comes from the Greek word for glue, and it's collagen that really holds our body together. It's the key ingredient in connective tissue. That's not just the ligaments, tendons, and muscles. It's also found very predominantly in the support structure of the skin and bone. So we're going to talk about how BioSil can be very helpful in improving the structural components of those tissues. Now, as we age, there's a natural loss of collagen. Between the ages of about 40 to 70, we'll lose about 80% of the collagen content, not just in our skin or connective tissues, but also in our bone. And collagen is to bone what 2x4s are in the frame of the house. So we're going to talk about ways in which we can increase the amount of collagen throughout your body. Now, as I said, as we age, there's a loss of collagen throughout the body, and this is really a problem. The decrease in skin collagen is associated with the formation of wrinkles and loss of the ability to hold sufficient amount of water in that skin. There's a strong relationship between the amount of wrinkling in the skin and the health of the bone. The effects of the loss of collagen are pervasive. It happens throughout the body and every tissue is affected. So what we see on the skin is really a sign of what's going on throughout the entire body. Now, the clinical research with BioSil right now is focused on its ability to improve the collagen content in the skin, hair, nails, and bones. But future research will undoubtedly show that it also has an effect on the joints, on the cardiovascular system, and even the brain. So there's a lot of promise with BioSil as a way to increase the content of collagen throughout the body. One question you may have is, well, why don't I just take collagen? Well, if you take collagen, our body will break it down into individual amino acids, and these are important building blocks, but you're not telling the collagen-producing cells to actually make the collagen. That's where BioSil comes in. BioSil can tell your collagen-producing cells in the skin, in the hair, in the nails, and in the bone to make more collagen. If we look at the effects of collagen increases on our skin, we can take a look at what happens when we've lost the collagen and we see wrinkling and loss of water content. As we restore that collagen, those wrinkles are pushed out. Wrinkles and fine lines will typically improve dramatically with BioSil. There have been several studies with BioSil on skin health, and in these studies, BioSil has been shown to reduce fine lines and wrinkles by 30% and increase skin elasticity by 89%. It's also been shown to have a very good effect on increasing the textile strength of the hair, as well as giving that hair a stronger feeling to it. It strengthens hair by 13%, thickens hair by almost 13% as well. One area of research that I'm really excited about with BioSil is its effects on bone health. As I said earlier, your bone is composed of collagen. In fact, bone contains about 40% collagen, as I said earlier as well. Collagen is to our bone what 2x4s are in the frame of the house. What happens is we start losing that collagen as we start losing what are known as bone mineral binding sites. So the calcium has nowhere to be anchored. If we increase that collagen content, we increase the number of these bone mineral binding sites, and that will then translate to increased bone density. So BioSil has been shown to increase the collagen content by 22%, as well as increase bone mineral density by 2% within the first year of use. That's a phenomenal result. Collagen is something that is really responsible for bone quality. There's been an over-focus on the density of bone, but that's really not the total answer to bone quality. Chalk is more dense than bamboo, but bamboo is much more resistant to breaking, and we want our bones to be more like bamboo. How do we accomplish that? Well, we accomplish that by increasing that collagen matrix within the bone. We don't want our bone to be like chalk. We want it to be strong, flexible, and resistant to fracture. We've developed a formula for strong, healthy bones that contains two supplements, one called the Bone Mineralizer Matrix and one called the Bone Collagenizer Matrix. This is a comprehensive nutritional approach to building strong, healthy bone. The Collagenizer formula, of course, features BioSil, but it also contains other nutrients like vitamin K2 that are very important to building the protein matrix of bone. The mineralizer formula contains highly bioavailable forms of calcium and magnesium, 1,000 milligrams of highly absorbable calcium, 500 milligrams of magnesium, along with 2,000 IUs of vitamin D and other bone critical nutrients. It's really a one-stop shop, a complete multiple vitamin and mineral formula designed to build strong, healthy bone. Bones cannot be healthy with calcium alone. Calcium alone has very little impact on bone health. We have to give the bone all the nutrients that it needs to build additional bone, and that's what we've done in the Healthy Bones Plus. For more information, you can go to biosilusa.com and healthybonesplus.com. The key point I want to get across is that BioSil stimulates the manufacture of the important glue known as collagen that holds our tissues together and is critical for healthy hair, skin, nails, and healthy bones. So please, go to these websites for more information. Thank you.